You know, when every major cable news outlet is reporting that there's a problem, that it's a big problem. And that is, of course, what's going on with the southern border and the lifting of Title 42, the pandemic-era policy that allowed for the federal government to turn migrants around that may be a health risk. And of course, with the pandemic lifting, and there's a lot of concerns that migrants are flooding the southern border, and how is that going to impact taxpayers, including in a state like Illinois? So let's just get right on to this, because it's pretty incredible just how much there is reporting on this. Let's go to Fox News. You have Bill Malusian laying out his reports on how this is impacting the border with Title 42 being lifted.
CBP sources tell me in the last 3 days in a row, Border Patrol has made at least 10,000 migrant apprehensions. Those are the highest daily totals ever recorded. Fox is also told in the coming days we can expect to see the largest wave of mass releases the U.S. has ever seen.
Obviously, a huge issue, especially when it comes to limited resources that even Border Patrol has, and how that's going to be maintained. But it wasn't just Fox News talking about this. You've got even CNN talking about how these migrants are being shipped to all over the place, including here in Illinois.
This is not just an issue that will affect U.S. cities near the southern border. Brownsville, Texas official says migrants are requesting transportation to get to Chicago and Dallas and Houston and Brooklyn and Denver and Miami.
So, again, a huge issue, not just for those southern border communities, but for communities all across the country, including here in Illinois, up in Chicago, and how that will play out with some of the suburbs, and are they going to have to take in a whole bunch? And where are these migrants going to be housed in Chicago? There's reporting out of the Tribune and the Sun-Times that community groups are trying to sue and block migrants from being housed in a high school, and that's just one area of consideration for where these migrants are going to be housed. But CNN even talking to some of these migrants and why they feel that they're coming north, and they obviously know what Title 42 is all about. Here's one reporter talking to a migrant in Brownsville, Texas.
Y una pregunta, ¿usted está enterado del título 42 y que iban a abrir la frontera como antes de la pandemia? Were you aware of Title 42 and that they were going to open the border like before the pandemic?
Sí, estaba enterado.
Por eso viniste, that's why you came?
Claro, igual que mucha gente.
Yeah. Okay, well, thank you. Gracias, muchas gracias, y suerte con tu viaje, Pedro. Pedro, it represents a lot of the stories here, the migrants that we're hearing on the streets. So many officials here have told us they are ready for what's coming next, projecting an air of confidence. Sarah, only time will tell if they're right.
Projecting an air of confidence, CNN reports. Well, I don't know if there's much confidence, especially coming from other reporting. MSNBC also having a report on the migrant situation. Here is that report from the border as shown on MSNBC yesterday morning.
Is that when Title 42 lifts, more will come because they'll think there's an ease in restrictions, and it will simply take them longer to process them. They're worried about overcrowding, and they're worried about how it will impact cities like El Paso. In fact, Jose Diaz-Balart just interviewed the mayor of El Paso, and here's what he had to say.
We prepared for days. We prepared for weeks. The city of El Paso, we don't do immigration law. We're here to protect our visitors, but also make sure that the community of El Paso stays and continues to be safe.
What keeps you up at night?
What keeps me up at night, I always tell people, is the lack of light.
What do you mean a lack of light?
Well, because I don't see a light at the end of the tunnel, and there is no end game.
Say there is no end game. That is really what I'm hearing, even from DHS officials I've spoken to, Andrea, say they feel like they're at the breaking point before they even get to the starting lines. But what they're worried.
Again, that's MSNBC with their reporting on the border border crisis that is being made more clear as Title 42 is lifted. Now, Alejandro Mayorkas, he is the czar of sorts of the border. He was at the White House press briefing room yesterday being asked about the ultimate costs, and here is Mayorkas.
You talk about costs. What's the rough cost to American taxpayers since the roughly 4 million people have come into this country illegally since January of 2021, as those people show up at community hospitals, as they enter the school system, as they get other government help? Do you have a taxpayer cost?
Let me turn that question around a little bit, because I'm going to turn it around to match the question that an international partner asked of me. And the question that the international partner asked of me is, what is the economic cost of your broken immigration system? Since there are businesses around this country that are desperate for workers, there are desperate workers looking for jobs, desperate workers in foreign countries that are looking for jobs in the United States where they can earn money lawfully and send much needed remittances back home. What is the cost of a broken immigration system? That is the question that I am asked, and that is the question that I pose to Congress, because it is extraordinary.
So he doesn't even answer the question of the cost to taxpayers, instead flips the question to talk about the economic impacts. Okay. Governor J.B. Pritzker was asked yesterday about the costs to Illinois taxpayers, especially with that cost that we've heard a lot about concerning migrant health care that the state is subsidizing, and the projected costs for the coming fiscal year that starts July 1st is more than $1 billion. And with the state already seeing fewer revenues coming in than previous months, you've got the questions on how that's going to impact the budget. Governor J.B. Pritzker asked about this yesterday at an unrelated event where he addressed the question of exactly how this is going to be paid for, especially with the limited dollars that there are coming from Illinois taxpayers that would have to foot the entirety of the costs for migrant health care. Here's Governor J.B. Pritzker.
Well, as you know, it's a program that's different than Medicaid and different than regular private insurance. It is possible, for example, that there could be, for some people at certain income levels, co-pays. That's an example of something that would defray the cost of the program. That's one example. Another is, a question about reimbursement rates and what level the reimbursement rate would be for whatever services are given to people. So those are two among many, but really we gave them many options to choose from and ideas that they could take back to their caucuses and talk about, and we've tried to answer every question that's been brought to us. But these are all things that I think are reasonable to consider to make sure that we're reining in the cost, but also serving the people who most need this health care.
So Governor J.B. Pritzker saying that premiums will help defray the billion-dollar cost that taxpayers are expected to incur from the state's policy of enacting, subsidized health care coverage for undocumented migrants in Illinois. C.D. Meyer, Republican state representative, he says Illinoisans are being left out of this equation, and he says that is an unfortunate situation when it comes to the overall costs of these things.
We deserve it. We're doing everything that
we're not helping children that are in harm's way. We're not providing the services needed for the developmentally disabled. We're not providing a number of services on a number of levels.
And C.D. Meyer says he expects Democrats to advance a policy that would allow for the age of migrant health care costs to be covered to be lowered from 42 to 19. And that's a measure that's pending at the State House. C.D. Meyer says that's a no-go.
If recent history is any guide, we should be concerned and we should be watching for what's going to happen in the upcoming BIMP, or if it's going to be slipped into some other random bill in the middle of the night that we're going to be forced to vote on in the last minute.
And a BIMP is the Budget Implementation Bill. And lawmakers at the State House here in Illinois in session until May 19th. We may see that BIMP in the final hours of session, along with the overall spending proposal, and that is all expected to be packaged up and passed before they leave May 19th. How much are they going to be paying out for migrant health care costs? That's a big question that remains unknown, but it could be north of $1 billion, if not more. It is Springfield's Morning News. I'm Greg Bishop on WMAY.